Welcome to the Medical Collective, your go-to podcast where medicine meets real life. I'm Dr. Keisha Davis, a pathologist, personal trainer, and your host. I will be joined by a vibrant team of doctors who are not just healthcare professionals, but artists, fitness enthusiasts, and advocates for change. Each episode, we dive deep into the world of medicine, from untold stories of the healthcare industry to the latest in medical advancements. We're here to bring your insights, answer your burning questions, and explore the art and science of healing. So let's get started and step into the world of the Medical Collective. Welcome you all back to the Medical Collective. Today is a great episode. We haven't had Dr. Dan in a minute, and we have him. So while he's here, questions are going to get answered, especially during summertime, because the episode today is about what's happening, what's bringing people to the ER during the summer. How have you been? How have you been, Dan?
I've been doing well. Thank you for checking on me. I've been doing okay, just been busy. Life.
Yeah, I know how that is. I exactly know. So let's get into it because some of these things are personally involving me. As you all know, I have two children, and one of them recently decided to take a four-wheeler out at my parents' house. So I'm out of the country, you all, and she decides to take a four-wheeler out, and she overturns. And now she's sitting here on crutches right now with a broken tibia and possibly tear of the ACL. So that's how we're doing, which kind of brings me to the first part of today. What's happening in the emergency room and what the statistics are, especially during the summer. According to the CDC, 155 million total United States ER visits per year. I think that's a lot. But the heat-related ED deaths, which during the summertime we've heard about it, we're having this heat dome. We're seeing a lot of places that normally aren't warm, very, very warm. And because of that, there's 119,000 plus visits just because of heat-related instances. 92% just between May and September. And even May is getting very, very hot right now. In September, males aged 18 through 64 had about 2 to 3 times more high-risk youth incidences in the ER we're seeing. We can talk about some of those things in more depth, but I think let's start with what's bringing people into the ER and heat-related instances. I'm sure you see a lot of that.
Sure. Yeah, so been seeing a lot of those. It's kind of routine that we typically see patients come in for a variety of things during the summer, the classics, and I'll go from pediatric to adult to capture everybody and family, since it's usually family time or it's outside time for those who are outside. One of the things for children that I do worry about are a lot of swimming injuries, drowning or near drownings. So that's important. Heat casualties. So forgetting a child in the car, forgetting their pet, or forgetting the elderly. Leaving the elderly on certain medication that can actually affect their temperature regulation, so they can burn up in essence, not physically being burned up, but they have fevers because actually their medication doesn't allow them to sweat or release all the heat, so they end up being a heat casualty, having heat stroke or heat illness, especially during these heat waves that we do see, or even just while it's just hot and there's no AC in the house or things like that. Same thing, we also see a lot of falls, trauma, because in certain neighborhoods, or if people don't have access to an air conditioner or cooling system, they leave the windows open, and then there's a toddler that's running around and, God forbid, then falls out of a 2-story window, 3-story, 10-story window, and they become a trauma that I end up seeing. So there are lots of things that we see during. I talked about the swimming injuries, and then we get the rashes. People get, they're exposed to poison ivy, poison oak, or they get insect bites and things like that. They go visit their friends or relatives, they get bed bug bites, so there's so different things that you have to think about. You're traveling, people want to be outside, they go on a trip, they're at a hotel or motel or wherever, and they end up getting bed bugs or getting bitten by that. So that's another thing. I know these are some gross things, but this is what they see. Doc, I got a rash. Okay, where'd you get it? Or people are outside having too much fun and not protecting themselves, and they have a rash in certain places. So then you got to say, Doc, hey, this was happening or I'm having some discharge, guess what? I got to see you for that. So there are many things that we see during this time. People just need to protect themselves, be aware of the risks that they engage in, and just have fun, but also be responsible.
Be responsible is key. And I want to go back to the heat related illnesses and issues because a lot of kids, though, are doing sports, Dr. Dan. Soccer is big here in Texas, as well as people are starting to get back to doing football, American football, should I say. And these children are out here during these hot periods of day. Like, what do you suggest they do? Should they even be doing it in the middle of the day at 12 o'clock, 2 o'clock?
So there are arguments about times of day because that's the time where there's a lot of sun and the heat is greatest. So you want to be out early in the morning before the sun really is at its peak before noon. And then you want to go maybe later on in the evening after 4, after 5. But it depends on which time zone you are in and what the weather's like. Sometimes it might be throughout the whole day where it's just a heat wave and it's hot and there's no air. There's a lot of humidity. So that can factor into it. You want to pre-hydrate, have people drink, have the kids drink, have the adults, elderly drink. Be aware of what medications they're on that could make them at more risk for heat injuries. Those who have asthma, those types of things. Loose clothing, not dark clothes, loose clothing, not all the way down to the legs, shorts and short tops, those types of things will probably help. And just frequently, they spend maybe 45 minutes during the activity as opposed to an hour. And then they take a break and have water, or for the younger ones, it may be 20 minutes in between and let them hydrate. Drink water. If you can't get water, then make sure you give them something such as an electrolyte substitute, be it Gatorade, Powerade. I'm not in support of those people. They're not paying me. But I'm just saying you need to make sure you stay hydrated. Tomato juice. There's so many different things that people can drink to keep themselves hydrated. And one of the quick signs that people will know if they're not getting well hydrated, if they're not peeing, not going to urinate. That's an important thing. Or their heart's racing really fast, or they're starting to have some blurry vision. These are late findings, which you shouldn't wait until that point. Or you start having cramps in your muscles or in your stomach. Those are all signs. So bananas, oranges, those are all good things to have on site, maybe when the team is practicing and during their activities. That will help replenish your potassium and also some of the electrolytes you need in addition.
So there's a reason for that. I remember I used to look forward to, so I played soccer when I was little, but I wasn't great, but I looked forward to time to have the orange slices. So
Yes.
you all keep
Yeah, I
the
did
orange
too.
slices going.
I did too, definitely.
So people are asking, and I hear this a lot, what's the difference then? You talked about signs, but what's the difference between heat stroke and heat exhaustion?
Yeah, they're all on a continuum, meaning they go on a straight line from least to worst. So a continuum goes just like that, and the beginning is heat rash, or malaria, as they describe it. Not malaria, malaria. So that's the prickly heat. So they get these little bumps on their bodies, red, raised, itchy during those times. Then you get into the heat exhaustion, or heat cramping, where you have cramps. You're still sweating a little bit, but you may have just weakness and cramping and pain, or vomiting, abdominal pain, headache, maybe some changes in your vision. And then, of course, then there's heat stroke, which is on the other extreme, which is where you actually have a fever and you can't release heat and it's an emergency. They might be confused. They might be almost comatose or just acting weird, like they're on something, like they're high. And they need to get to the emergency department quickly. We need to reduce their temperature and lower it. They might get ice packs in the groin or in their axilla, your armpits, and things like that quickly. Well, it's a good place to release heat. Typically in the armpits, you'd be sweating, right? A lot. So that's the area where they're not sweating. So you put those in the armpits and in the groin. But that they still need to come to the emergency department because sometimes they may end up having seizures, and some can die. So it's not something to play with. We need to check your electrolytes, your body fluids, your kidney function. You may need to get a lot of fluids and things like that. So very important in patients, especially also patients who have diabetes and also have respiratory problems.
Hello, listeners. We want to remind you that you can catch The Medical Collective on all your favorite podcast platforms. That includes Apple, Spotify, and YouTube. Be sure to hit that subscribe button so that you never miss an episode. We're also on Libsyn, and you can find us on all social media platforms as The Medical Collective. Do you have thoughts or questions? Please don't hesitate to reach out. We love hearing from you. Now let's get back to the conversation. Well, something that has been released by the CDC, which I think is kind of neat, is this heat risk dashboard, and then even a smartphone tool that people can use to guide them when they're going through these situations, whether it's themselves or another person. So we will put that in the show notes so people can have access to that. I'm not sure if you have any experience with that, Dr. Dan.
The heat index is good to use, and the service we used to use those. People can use it in the public, but really much paying attention to yourself, your body, and the temperature. You should be monitoring the daily temperature for the week, so you know how to plan. And it does change. So check it daily, so you know, hey, when you should be out, when your kids should be out. Also, alcohol. When you drink a lot of alcohol, it gets you dehydrated. So that's something also to reduce your alcohol intake. I think one of the jokes was when people want to get lit during the time that they need to be outside. They want to be outside party, but also make sure you hydrate and drink plenty of water while you're doing that. The other part is that we didn't talk about is injuries. So we see a lot of injuries because a lot of people do a lot of contact sport during this time. And the kids, as you mentioned, they're in camp and all that stuff. So we do see a lot of football, basketball, and all those type of
Do you
injuries.
see four-wheeler injuries?
We do see four-wheeler injuries, ATVs, all that stuff. Even those who go on the trips, they wanted to be outside in Miami or wherever, or anywhere in the country, or in the backwoods, and they're on the ATV having a good time, or people on trampolines doing all these things. I don't ascribe to those things, especially for kids. I'm not a fan of trampolines for them because I just see those injuries all the time. ATVs definitely can be really bad. Just make sure they're wearing a helmet and all the things to protect themselves and know what they're doing. And I'm sorry that your daughter got injured, but yeah, I'm glad that's all she had, because a lot of them have abdominal injuries and head injuries, which can be really, really bad too.
Very, very true. Something else, I did an episode recently on foodborne illnesses and what's in your potato salad. People are doing picnics, Dr. Dan, and I'm sure you've been to them. A lot of us share it. We don't eat everybody's food, unfortunately. And some of that is because of the risk of foodborne illnesses if it's not prepared right. So are you saying that too? A lot of people with stomach pain?
Yes, gastro, the diarrhea, they got the shits and giggles, as I call it. So that's what it is. They got the runs. They come in. They've had the symptoms for a couple of days. Some it's just the first day, exactly in a few hours after eating. So classic distinction, quick little things. Foodborne illness usually occurs within 24 hours, so or less. So literally, you ate something 2 to 5 hours, maybe 6 hours later, you start having the weird feeling, and you gotta go, and you gotta keep going, gotta keep going. That's probably foodborne illness. Sometimes it can be if you traveled overseas or you're eating some uncooked cruise ships all the time. Norovirus. I'm not knocking on the cruise ships, not discouraging folks, but it's not just cruise ship. It could be at a salad bar where there's a whole bunch of people there and things like that. And yes, they get the runs there. Norovirus is one of those. So you see, noro is stinks. But not only does that, they're just uncomfortable for a while. So y'all can look that up. Norovirus, Noro virus. That's not one of those fun viruses. But anyway, you can get that. You can get bacterial illnesses, classic, and potato salad and other things. Also pork that's not well cooked or meats that's not well cooked. Again, people have to be careful. Strict hand washing. So if you have the runs, make sure you're washing your hands and be as hygienic as possible, and don't touch or share stuff with other people. And people shouldn't be sharing other stuff with other people during these times, because you see it. But people usually survive these things. The ones that are concerning, that you probably need to really get help if they're what we call enteroinvasive, meaning they actually have gotten into the guts and cause you to bleed. So they're having blood in their stool or blood in their vomitus. that's a problem. So you may need to be seen immediately because it could be very severe or really bad, like salmonella or Shigella. Some even have toxins that they secrete, such as Shigella and E. coli. The classic one is what I call the James Bond E. coli, which is H17057, right? And that one is the one that's not good, not fun. Shigella also, Shiga toxin can also release some toxins and like toxin and cause seizures in addition to the diarrhea and vomiting. So lots of things to worry about, but also people have to have fun, live their life, just be as safe as possible.
Yeah, and then also there have been food recalls. So food recalls actually in the store. One of them recently was with some prepackaged meat at Walmart and some other stores. And because of the toxin that he's talking about, there have unfortunately been 3 people that have died from this outbreak.
Yeah, listeria. I mean, there's so many other things that you can see. So be careful what you eat. Make sure it's well cooked. If you hear about a recall, share it with your family so everybody knows, so they don't get it. And with all these regulations and guidelines that are being changed, and not having CDC a good enough staff, and everybody was hating on CDC during the COVID time, but you got to understand these people are lifers. They've been doing this for a minute, and they actually do their job as much as they got a lot of flack for it. And now they released a whole bunch of them, and now everybody's looking like who's got our back. Well, now we see the value, hopefully, but yeah, it's not a good time for all these things to be cut. That can affect also our health and our families.
That's a great point. Before we close, Dr. Dan, if you could give a story maybe of what you've seen with a child or somebody coming to the ER during the summertime and kind of work through like what you do as far as labs, as far as workup, right? To into the great ending where they go home healthy.
Sometimes it's a happy ending, not that kind of happy ending, but it's a happy ending where people are happy, and they get to leave out the emergency department. And sometimes it's not like that. Classic stories. I mean, I have many. I'll give some examples. I had a family that came in during this height of concern for measles that they thought they all had measles, where they had a rash, but it was hand, foot, mouth that was actually going around in the family with the kids and spread to some of the older kids. The adults didn't get it. So they were fine, but it's kind of the history and going through. So I say, okay, what happened? My resident or a medical student may present a story to me, or I might see them myself and I hear their story, and we kind of have to figure out, we have to isolate this patient first and make sure everybody else is protected. They got a mask, everybody else got a mask around them, and it's in a negative pressure room for this case, this scenario, where we're concerned about measles. But it ended up being Coxsackie virus, which is the hand, foot, mouth virus for all those who are listening. They
Well,
usually
it's
have a
very
rash.
timely given the number of cases we're having now.
Yeah.
So
So it kind of, and it presents almost, there's some similarities. So it was on the hands and feet, and they were freaking out, and they had a fever and all this stuff, but they had sores in their mouth and all this stuff. So we go through the exam, we get the history, talk with them. Hey, I introduced myself. Hey, I'm Dr. Dan Fabui, yada, yada, yada. Here I am. How can I help you? What's been going on? Tell me the story. And I like to listen. 90% of our diagnoses are made really by the story that you give us. If you give us a good enough, accurate history, 10% maybe the testing and the physical exam. But really, it's the history you give us. And then you do the physical exam, and then you do labs if you need to. Sometimes you don't need to. It's just a clinical diagnosis, meaning we get all that story and it kind of fits into a pattern, and what we've seen. So experience also matters. And then we kind of take it from there. So in this case, we looked at it, and the history was the other siblings had it. They had a fever. Looked in the mouth on the exam. There wasn't any Koplik spots, which you typically will see with measles, although it may not also necessarily be there. But the history of how the rash had spread on the hands and feet and on the chest and torso. Usually with measles, it'll start on the scalp and then kind of work its way down. So there's centripetal, centrifugal, anyway, all the fancy terms that we know about. But for the public, it's just a pattern of how the rash spreads, where it is, and then what the sores in the mouth look like. Oh, and there are other people at the child's daycare that had the same thing at the same time. Okay, so this is following some type of spread, viral spread pattern. And those are all the things we do. If we have any doubt, then we would get a test for measles. In this case, we didn't have any doubt. It was clear cut. So we didn't get the test. The patient did fine. Immediately, hour and a half later, I discharged them from the emergency department. They went home. We give them stuff for pain, of course, like ibuprofen or Tylenol, and also magic mouthwash and other things that basically have Benadryl, some aluminum hydroxide, and if it's an older kid, they can have some lidocaine in it. And we mix it and they just dab it on those sores. The sores will go away within less than a week. So that's kind of how you manage those cases. The other stuff, trauma, had a gunshot wound the other day. It's really, hey, where's the bleeding from? Oh, they're bleeding from the side of their chest. Okay, cool. Well, we got to put a chest tube in and make sure they can breathe. Their lungs hasn't collapsed and they're not bleeding on the inside. So we go through a whole exam, airway, breathing, circulation. Are they breathing? Can they speak? All right. Do they have good pulses? Do they have good blood pressure? Okay, we got all that. Let's do a quick fast exam, a sonogram exam to see if there's any blood in any pockets of the body. And after we do that, we get some x-rays, boom, 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 take the chest, the pelvis, make sure there's no other injuries anywhere else. Are there any entrance or exit wounds? We usually don't say entrance and exit now. We just say, are there wounds? Because we don't know which way it went or where did it go. Yeah, I see a wound and I see another wound on the other side. Okay. So the bullet's probably out, but let's get the x-rays to make sure. Boom, boom, boom. Patient's still breathing, doing okay, great. Oh, this patient's blood pressure is dropping. We need to go to the OR immediately. Contact the surgeon. They go to the operating room. They found some bleeding. And we transfused some blood and gave some pressures. The patient went to the ICU. Fortunately, they made it out 6 days later out of the ICU. So that's how it kind of goes. And it's real life. And, so these are decision makings that we do all the time. So that's my story time.
Wow. Well, I hope you all enjoyed the story time, the good and not so great, but this is really what happens. And I think the ER is like the neatest. It's the beginning point a lot of times, and sometimes the ending point for a lot of people's adventure into whatever healthcare issue they have. So thank you for that, Dr. Dan. Next time, everybody, we will talk about some strange things that Dr. Dan may have seen or sometimes come to pathology as far as the ER. So
Yes.
Until then, have a great time. Stay safe, you all, and stay healthy. Thank you for tuning in to the Medical Collective. We hope today's episode has left you with valuable insights and a new perspective on healthcare. Don't forget, follow us on social media for more updates and behind-the-scenes content. I'm Dr. Keisha Davis, and it's been a pleasure to share this time with you. Stay healthy, stay informed, and we'll see you in the next episode, where medicine continues to meet real life. Please note that the content provided in the Medical Collective podcast, including text, graphics, images, and other material, is for informational purposes only. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The views and opinions expressed on this podcast are solely those of the individual authors and guests and do not represent those of the Medical Collective, its staff, and any affiliated entities. The appearance of content on the podcast does not imply an endorsement. Neither the host, Dr. Keisha Davis, the co-host, or any guest of the podcast bear responsibility for the accuracy of the content provided or the use of information received through the podcast. Reliance on any information provided by the Medical Collective podcast, its employees, writers, or guests is solely at your own risk.